Hi, I'm Dr. Wilshire. So you're pregnant. Now what? A lot of women know when they're pregnant. They've got a very good idea. Some women, particularly those who have irregular periods, can't always be so sure. So you've missed your period, you're feeling puffy, things are smelling funny, your boobs hurt, you're very suspicious you are pregnant. First thing to do a home pregnancy test. The test will tell you you can test your urine at any time, but you tend to get better results if you use morning urine when it's concentrated. So now you've done a test and you get two lines or one of those positives. It's clearly positive. Now what do you do? Well, I'm somewhat superstitious, and I highly recommend that you not tell the world. Do not announce this on social media. Don't go blabbing it everywhere. Keep it close to the vest, at least in the beginning. I highly recommend you call your OBGYN or maybe your family practitioner or primary care provider and get a blood pregnancy test. Get an actual number. It's called a quantitative beta. It'll give you an actual number. We like to repeat that blood test in 2 days, and it should roughly double, give or take a little bit, and that'll be another indication that you are pregnant and that it's healthy and it's in the right location. Now, if you call your OBGYN doctor, you might get a response, something like, congratulations, we'll see you in 2 months. You'll get that kind of response from a busy general OBGYN practice. These practices and these doctors generally see healthy, spontaneous pregnancies, and the risk of miscarriage or ectopics is fairly low. In my practice, however, we see women with lots of risk factors and lots of potential problems. So as soon as a woman calls us with a positive pregnancy test and we get those two all-important blood tests, we generally recommend an ultrasound at about 2 weeks after you missed your period. The ultrasound, in my opinion, is very important. We need to make sure the gestational sac, which we should see by then, has a little yolk and potentially a little fetus in it. We need to make sure it's in the right place, in the uterus. There's at least a 2 or 3% chance the pregnancy is not in the uterus and in the tube. And the sooner we know of a potential ectopic pregnancy, the sooner we can treat it, save your life, and maintain your fertility. So in my practice, we like to do sonograms early, although don't be surprised if your general practitioner puts the sonogram off for another month or two. Now, what else can you do if you now confirm you're pregnant? Well, first of all, review your medications. Don't be taking any medication you don't have to take. If you are taking prescribed medicines, check with your doctor or provider and make sure they're safe in pregnancy, or at least of low risk. With medications, you frequently have to weigh the risks and the benefits, and sometimes the decision is tricky. Obviously, you don't want to take any medicines you do not have to. Supplements and vitamins are okay as long as they are reasonable. Obviously, if you're pregnant, you want to avoid smoking, toxic exposures, beware of pesticides and other fumes in the air that might be poisonous. And something else to avoid are things that increase your core temperature. You don't want to do any activity that increases your core temperature. These include long hot tubs and potential marathon running, although most of us don't run marathons, generally not a problem. So use common sense, good nutrition, avoid toxins, and don't be afraid to talk to your doctor or other healthcare practitioner. So if you think you're pregnant, follow those steps, do everything you can, and hopefully you'll be rewarded with a healthy, successful pregnancy.